So, time for a very unpopular opinion. There's not too little healthcare in the United States of America. There's too much. I'll start by acknowledging that the liberal science, university, industrial, medical, pharmaceutical complex that runs healthcare in America has pushed medical science so far in the past 70, 50 years. It's amazing. If I'd been born in 1900, I'd be dead by now. And not just because I'd be 126 years old. Because the cancer I got in 2011 would have killed me probably by 2012. But it didn't kill me. Partly because the science, university, industrial, medical, blah, blah, blah complex, encouraged and funded by the government, has poured a lot of resources into advances in cancer treatment. Life expectancy has increased in the United States of America since whatever the 1960 or 1970 or 80, whatever, partly because the United States has put a lot of money into the endless medical industrial complex that we live with today. But it's also poured a lot of resources into endless studies that prove nothing except that the medical, academic, pharmaceutical company complex can spend almost an almost unlimited amount of money on studies that prove nothing. Many of these studies are actually funded by device makers or pharmaceutical companies, and they show some benefit to something, some new treatment that costs a lot of money, and then follow-up studies don't show any benefit at all. So the U.S. has poured all this money into these fancy machines and various forms of technology, and the cost for those falls on hospitals and medical practices and providers, and it costs so much to buy and maintain these machines that they have to charge more for every single thing that you might get, like a blood test. So insurance companies and medical device providers and pharmaceutical companies, they make lots of money. But the people actually providing the care, like the medical practices, they don't make so much money. So that science, university, industrial, pharmaceutical complex, funded by your taxpayer dollars, has also come up, admittedly, with amazing drugs that have improved the lives of countless people, including myself, and have saved the lives of many. That complex has also, as many people have noted, led to an expansion of drug advertising and absolutely staggering pharmaceutical profits. That medical industrial government complex has gorged itself on American dollars. It has also managed to make Americans, particularly elderly people, overdrugged. One of the most common causes of death in America is medical error. And one of the most common causes of medical error is drug interactions. So overdrugging doesn't have to be life-ending or life-threatening to affect people. So many of us are familiar with getting a prescription for one thing that causes side effects that are then treated with another prescription for something else that causes different side effects. And so the doctor recommends that we get yet a different prescription to deal with the side effects from all the drugs that we're already taking. Excuse me, which leads to a shit ton of pills and still feeling like shit. And I haven't even mentioned the preventative drugs. Americans are persuaded to take drugs to prevent heart attacks that haven't happened, to prevent diabetes that people don't have, to prevent strokes that people aren't getting, drugs to lose weight, drugs to prevent osteoporosis, and on and on and on. So here's something you probably don't know about all those preventative drugs like statins and blood pressure medications. They don't work for most people. It is, they don't prevent anything. Statins prevent heart attacks in about, not necessarily fatal heart attacks, just heart attacks, in about 10% of the people who take them. But no one knows in advance which 10% that will be. So doctors are encouraged to give statins to everyone who might possibly benefit, which means that 90% of the people who take them aren't getting any benefits. They may or may not be getting side effects. They may be on these drugs and paying for them for life. That's unapologetic public health. Unapologetic public health, enthusiastic public health, because it benefits the public. That is, it benefits the total population. So the medical, industrial, government, pharmaceutical, blah, blah, blah complex thinks that's a good thing. It may or may not benefit you. But that isn't what you're told. What you're told instead is that a statin may reduce your risk of a major coronary event by 30%. And what you hear is you're going to have a heart attack if you don't take it, and that your doctor wants you to take it. Until suddenly you're 65 and taking 7 prescriptions a day. So when your doctor tells you that this medication reduces your risk of whatever by 30%, you don't know what that means because you don't think to ask, because nobody tells you to. 30% of what? So you think it's 30% of 100. It's not 30% of 100. You might have a 2% or a 7% risk of having a heart attack within the next 10 years. And if the statin reduces that by 30%, that reduces it by a third of 7, and a third of 7 is 2 and something. So you go from about a 7% risk to about a 5% risk. But you don't know that because nobody tells you that, because that isn't the way the public health, industrial, pharmaceutical, medical, academic complex thinks of it. So this is the kind of thing that pisses people off. It makes people go maha and distrust not just pharmaceutical companies, but every single thing in American healthcare that charges money, and everything in American healthcare charges money, which is not good. So Americans are overtreated, overdrugged, overtested by all the machines, and they suffer for it. It costs them a lot of money. It costs them a lot of time. It costs people a lot of worry. It costs people side effects. There are unnecessary tests that cause pain and distress. And do you know why Americans are overtreated? Because they demand it. Because Americans are apparently terrified to live without all that overtreatment. Because Americans lobby for it. Because they don't trust the medical, university, industrial, government, pharmaceutical company complex. So they actually want more treatment and tests because they think the medical system routinely makes harmful decisions based solely on money, which it has been essentially proven it does. So people try to fight back by getting more medical intervention to counteract the effects of the medical intervention that they think they're not getting that they should, or the medical intervention that they think they are getting that they shouldn't. And I haven't really even talked about the role of insurance companies in overtreatment, which is such a tangled web of deception and horror that it would take a long time to even begin to describe it. I'll just say that what insurance does and doesn't cover, insurance including Medicare, means you get overtreated and overtested for some things, including things that you don't need to be tested or treated for. If insurance doesn't cover your I don't know, your radiation therapy to treat your cancer there, and you might be shit out of luck when it comes to a disease that you actually have. Or if insurance doesn't cover the valve, the stent that will actually allow you to live for 7 more years in a productive way, if insurance doesn't cover it, then you won't get that. You'll get all other kinds of stuff, but you won't get that. So there's an exasperated saying in America, which is, make it make sense. I can't. No one can. No one on the entire planet can make the American health system make sense. So I don't have all the answers. I don't have to tell anyone to get pretty fed up with the American healthcare system, because everyone who still has a functioning brain, or even just a heart, still has a functioning heart, is already pretty fed up with the American healthcare system.